credit to them because this was not our concept, so we should acknowledge that. So we gather today as an act of solidarity to the African American community. We want to say loud and clear that violence against blacks is a health crisis. This is not an issue of the black community. This is a human rights issue, and it's our shared responsibility. When talking about racism, it's very easy to point fingers at obvious instances of violence, such as what happened with the killing of Mr. George Floyd. Just 2 days after his killing, Tony McDade, a 30-year-old black trans male, was killed in Tallahassee. A couple of weeks early, it was Ahmaud Arbery. Before that was the murder of Breonna Taylor, and the list goes on. Police brutality is just one of the clinical manifestations of systemic racism. Institutional racism is part of the fabric of the United States of America. We see it in the judicial system, education, housing, and the healthcare system, just to name a few. We often talk about negative outcomes in the African American community for chronic diseases and acute diseases such as diabetes, hypertension, asthma, and cancer. African American women are 243% more likely to die from pregnancy or child-related causes, even when adjusting factors such as income and educational level. We need to have more conversations about how racism influences these outcomes. Saying data is not enough. I'm going to borrow a quote from a very wise physician of mine, and I found it very beautiful and just inspiring. We are all human, even physicians, and we all, regardless of our skin color, need to educate ourselves about racism. However, this is especially true for white people, who need to examine how they contribute to the structural system of racism, and for physicians who care for others' well-being. Thank you. We are very honored to have a delegation from the Student National Medical Society. We have their president, Sophia. We have our speaker, Richard Beckett Ansa, and we have their vice president. So I'm gonna leave it up to Sophia to come this way and speak. I'm sorry, Richard.
Thank you all for coming today. My name is Richard Beckett Ansa again. I'm a medical student at the UNC School of Medicine. And today I just want to talk to you about some of the actions requested by the School of Medicine to our administration and to people all over the community. We want implementation of anti-racist longitudinal education within our preclinical and clinical education, not just in our social health science curriculum. We want provision by the UNC School of Medicine administration for Black students of mental health resources and access to Black mental health providers as well. As well as administrative excused absences for clinical and preclinical students who need time to grieve. We want institution by the UNC School of Medicine administration of mandatory longitudinal racial bias training for all clinical and preclinical instructors, faculty, and staff. We want the creation of a faculty-led coalition of administrators, faculty, and staff who support students in dismantling systemic racism within the School of Medicine. We want recognition of the School of Medicine's history of slavery and discrimination. We want the creation and dedication of a memorial to commemorate Black lives in the new medical education building. We want the creation of a scholarship fund for Black students to increase diversity within the student body. We want the UNC hospitals to adopt Voter, a nonpartisan, nonprofit organization that places voter registration QR codes on hospital badges and the promotion of local voting initiatives. Racism killed George Floyd. Racism is a violent pandemic that has led to the deaths of far too many. Only together can we rid our country of its current raging pandemics of COVID-19 and racism. When I is replaced with we, even illness can become wellness. And we invite you all to join us. Racism is a public health crisis that commands our attention. Say their names, learn their stories, and demand justice. Thank you.
My name's Candace. I posed a question. I sent out an anonymous project survey, and I asked, have you ever experienced individual or systematic racism? These are some of the responses. Okay, I'd like to share their stories with you today. This story is from a hematologist. There is a pervasive misunderstanding of the prevalence of hemophilia in the persons of African descent. The parents of a 2-year-old boy brought him to the Wake Forest Med ER 4 times for abnormal bleeding. 3 times they reported to Child Protective Services for suspected child abuse. Only after the 4th time was a PTT drawn. And the child was diagnosed with hemophilia. It was easier to believe that a Black family was beating their child than to evaluate a child for a potential bleeding disorder. And another one of my patients was seen in the ER because he needed syringes to infuse his clotting factor and was arrested. The nurses thought he was a drug abuser, and the police handcuffed him since he had to be a drug user, since no Black person actually has hemophilia. We see everything through race-tinged glasses, and it requires active learning to dial back the effect of those filters. I personally am of Asian descent and have suffered physical and verbal abuse by patients, micro and macro aggressions by faculty and staff as I've gone through training. At the VA, I was assaulted in the psych ER by a veteran who called me a goop. I've been told I was a commie ching bitch when I wouldn't prescribe narcotics. The grad students in the lab I worked in the summer between my 1st and 2nd year of med school told me she didn't like Orientals since they were inherently dishonest. I've been told that Asians weren't natural leaders when being denied leadership positions in medical school. And there's the, wow, your accent is barely detectable. When I was born in Detroit. And I want the American doctor. Did you even train in the U.S.? This is another one from a provider. As a black health provider, I have had multiple Caucasian patients ask me where I got my medical degree and wanted to speak to my supervisor to confirm that I know what I am talking about. Here's one from another physician. I am often not considered somewhat deserving of respect until I wear my white coat. I am often referred to or assumed to be a respiratory care technician as opposed to the physician that I am. Here's from a student. It doesn't stop at the hospitals. It's in our curriculum. Last year, as an MS2, I went through a 5-week reproductive system block with absolutely no mention of black maternal health, a widely known and obvious problem in the field of OBGYN. We were told there was no time. In our 3-week endocrine block, we had at least 3 separate lectures on transgender health. In the one lecture that black maternal health was mentioned briefly, it was insinuated that genetics of black women played a role in their poor health outcomes. That to me showed intentional avoidance and purposeful insensitivity to not make the time to discuss and educate future doctors on fatal issues. At one point, I was told that some physicians, block directors, didn't feel qualified to talk about racial disparities. I think it's unacceptable that physicians who are considered experts in their specialty not to be educated and aware of disparities that exist. To me, that is not an expert. Here's from somebody that schedules patients. I schedule patients for appointments. During scheduling, I have been asked by the patient the race of the provider, then asked to find them another clinician. This is regarding to an African-American patient. A 32-year-old African-American male suffered a right thigh contusion from a work-related injury. It resulted in a large hematoma that caused pain and disability. I referred him multiple times for evaluation and imaging. At each step along the way, he felt his concerns were not followed up on. I had to personally email the doctor seeing him to have his follow-up procedure that then had complications. It took 18 months. As a result of the delay in treatment, he now suffers from chronic pain in the leg with scarring and disability. This is another one. A patient of mine encountered multiple barriers in receiving care that are almost certainly related to him being a large black man and history of incarceration. This speaks out to the care for black mothers. I repeatedly see young black mothers being treated with less respect and patience on our hospitals as they need more help with breastfeeding, have partners who don't fit society's view of what a husband should be, even though they are amazing young men doing the best they can, and express fear over going back to precarious workplaces. And this last story I'm going to tell you about, this provider did not want to remain anonymous. She wanted me to say her name. This is from Dr. Rashida Monroe. My family has been impacted by racism in medicine. As a physician, I have had horrible interaction with providers who cared for my brother and father during critical illnesses. I'm going to tell you the story of her brother. My brother developed myasthenia gravis as a young, otherwise healthy adult. He was told by an older white male physician that he was lying about his symptoms. The physician even talked with me over the phone, and despite my pleas for help and reassuring him that my bright, healthy brother with no psychiatric history was indeed having weakness and inability to perform daily tasks, he continued to express that my brother was either lying or crazy. It wasn't until I called his colleague, a black female physician, and made a plea for help in assessing my brother that he received the adequate care. It was her assessment and tests that she ordered that revealed he indeed had MG. Only days after, he called me in such a terrible state of weakness that he said, "I hope we figure this out before I die from it." After he was appropriately diagnosed, he received appropriate treatment and is leading a full and healthy life today. I want to say to those that shared their stories, this was only a few, thank you for sharing your stories. As a future black female physician, I want my black and brown communities to know I hear you, I see you, I honor you, I feel you. Change by holding myself, colleagues, administration, family, and friends accountable. In a moment, we will be taking a moment of silence, specifically 8 minutes and 46 seconds. That was the amount of time the officer was on George Floyd's neck. We ask that everyone lay down and surrender to your thoughts in the process. Allow the stories of our healthcare workers to echo and resonate. I challenge you to think of ways we continue this movement beyond the park into your institutions, hospitals, offices, homes, and most importantly, into your hearts. Remember Tony McDade, Breonna Taylor, Ahmaud Arbery, and George Floyd. Remember how he begged for his mama and uttered his last words, "Please, I can't breathe." We have to breathe for him. It's up to us to continue the marathon for human rights and social justice. Thank you.